all doing well. Let me pull up my screen so I can make sure that I can see the chat. I can. All right, that's great. So we're going to start this off, this live Q&A, as we always do, with a gratitude practice. So this is just an opportunity and part of our energy mindset practice that we do, that we teach in the program. Very important to remember gratitude every single day. Just remembering 3 gratitudes is all it takes in order to significantly improve your mood. There have been some very good studies on this. So just take a moment and express thanks for whatever it is. Thank you for the weather. Thank you for my amazing wife, my amazing daughter, my cute animals, whatever it is that you're grateful for today, just give thanks. Hey Lee Yi, welcome, welcome. Yeah, if you guys are here watching, please drop a comment in the chat and we'll get this party started. Let me know where you guys are from. All right. So let's start off with our questions today. We're going to start off with people who submitted them first. So we have Ivanka here. So Ivanka asked, what do you recommend to me for extreme light sensitivity? I get numbness and weakness or pain in various parts of the body if I go into the sunlight or in modern LED or other so-called efficient light bulbs. I can tolerate 40-watt old light bulbs. Thyroid, adrenal, low stamina problems. Okay, so it looks like your energy is about a 3, and you're working on adrenals, mitochondria, thyroid, vitamin D, and then some toxicities. Okay. And so in terms of the light sensitivity, I'm going to assume that part of that has to do with sensitivity in the eyes. So one of the things that the adrenal gland is responsible for is contracting the iris. And that's kind of the contraction of the iris changes the way that light comes into the eye. And so oftentimes people who have adrenal gland dysfunction are not able to contract the iris particularly well. Consequently, there's more light that's coming into the eye than is able. So oftentimes, these people are going to be walking around with sunglasses, tinted glasses, or keeping the lights down low. So it's definitely working on the adrenals. Now, remember, the adrenals are responsible for managing stress in the body, and those stressors can be mental, emotional, or physical. And those physical stressors are things like heavy metals, chemicals, molds, infections, allergies, negative emotional patterns, electromagnetic fields, right? I'm actually going to jump into the workbook here that we use in the program so that I can share this with you and you can see what I'm talking about. Okay, so here's the workbook and you can see, so here's the adrenals over here. They're managing stress, but these toxicities are the things that end up causing the adrenals and 80% of all these things over here to become dysfunctional. So I'll say that again. These toxins are causing these things over here to be dysfunctional. So whether it's adrenals, other hormones, whether it's the mitochondria, etc., vitamins, minerals, etc., except for the lifestyle habits here, those obviously are not dependent on toxicities. All those other things are caused by the toxins. Okay, so, and you're looking right here at causes of fatigue, deficiencies, things that are not in the body that are supposed to be, and then toxicities, things that are in the body that aren't supposed to be there. But that kind of, because the treating the adrenals is like this 1-2 process where you have to boost the adrenals in order to feel better, in order to fix the adrenals. And then you also have to remove the toxins and the stressors, mental, emotional, and physical, that are causing the adrenal gland dysfunction. So hopefully that makes sense. Let me see if there was another part of your question. You said numbness and weakness or pain in various parts of the body if you go into the sunlight or modern LED and da-da-da-da-da. Yeah, so the other thing too is that the more toxins that you have in the body, the more they've built up over time, that whole list, the more reactive you're going to be. The more of a load there is on the liver, the more of a load there is on the immune system, and consequently, the more dysfunctional the immune system is going to be and the more reactive it's going to be. Because when you think about inflammation and you think about the immune system's job, the reason why we have inflammation is because the immune system notices that there's something in the body that's not supposed to be there. It goes after it, takes care of it, wraps it up, and gets rid of it. Well, if it can't wrap it up and get rid of it, like many of these toxins, because they're hiding in different parts of the body, then you get stuck in this chronic response where the immune system's trying to get at something, and unfortunately, it ends up damaging different parts of the body, causing inflammation. The inflammation is then the adrenal gland rather then produces cortisol as our main anti-inflammatory to try to decrease the inflammation, and then you run out of cortisol over long term because of the chronic stressor, and then you get adrenal gland dysfunction. So hopefully that is helpful for you. I would definitely focus on replacing the adrenals, working on your mitochondria, working on your thyroid. We call those the big three, and they're so incredibly helpful for everything else that we do. And then removing the toxins, the ones that you mentioned that you have present. So looks like you're on a good path, Ivanka. You'd probably just need some hand holding and to deal with all the bumps along the way, because there are inevitably bumps. And if you want our help, just reach out. We'd be happy to help you with that. All right, next up is Mary Lee. Thank you for your question. What probiotics should someone with microscopic colitis take? I said S. boulardii isn't always a good choice. You take this and Megaspore Biotic by Microbiome Labs. So that sounds fine. So the microscopic colitis is generally autoimmune in nature. If it is, because microscopic colitis is somewhere in between ulcerative colitis and Crohn's, it's kind of in the inflammatory bowel disease. And so it's autoimmune in nature. Now, every single thing, I'm going to share my screen once again. So if you want to look at what's causing autoimmunity, it's all these toxicities. All these toxicities will trigger the immune system to then attack itself. Either the immune system is going after one of these toxins that's hidden behind a cell, and consequently it damages the cell on its way in, or it's over here working on this infection, and then it pivots, and then it starts going after something like in the intestine. So you do want to remove these things. But to answer your question in terms of the probiotic, the Megaspore probiotic is great. I definitely like it. I would also be using the Mega IgG 2000, which is wonderful for stabilizing and the immune system in the gut, as well as binding up a lot of those toxins and a lot of the bacteria that's present. But you're going to want to figure out what is triggering the autoimmunity. S. boulardii is fine as long as you notice that you're not having a negative reaction to it. So I have seen people have a negative reaction, and part of that is most likely that it's a die-off reaction, because S. boulardii is a yeast. If you have yeast in the gut, the S. boulardii will push the other yeast out, but sometimes the immune system is also reacting to the Saccharomyces boulardii. And so it's just introducing another infection or another bug that can trigger the immune system. So if you're taking it and you're not noticing a problem, then it should be fine for you. Hopefully that's helpful for you, Mary Lee. Oh, and let me go ahead and check. Is there a way to share the worksheet? I can definitely, the workbook you're talking about. So the full workbook is when you join the program, but I can definitely share a portion of it. We're actually working on getting you guys that information. So whatever I can share, I will. I'll make a note to make sure that happens. Okay. So that is Mary Lee. And then Karen had a question. So what tests are used to identify viruses and retroviruses? Do they respond to similar treatment? Great question. So the serology tests are the main ones that are used for a lot of the viruses. And so this is an immunoglobulin test. This is looking at the immune system's response to a particular virus. There are a number of different components to the Epstein-Barr virus, the outside, the inside, that we're looking at the immune system's reaction to be able to determine whether or not you actually have it, or whether it's in the past, or whether it's reactivated, whether it's acute, all those sorts of things. When we're looking at cytomegalovirus or HHV6, those are generally serologies where we're looking at immunoglobulin G and immunoglobulin M. And I can actually give you a little bit more specifics. Let me go ahead and share my screen again. And so if we go to, let's go to the Epstein-Barr section, or maybe I can do it by going down here. So those are deficiencies. Here's the toxicities, heavy metals, chemicals, infections. Here we go, viruses. Oh, that's fancy. Okay, so in terms of Epstein-Barr, you want to look at these markers. So the VCA-IgM, VCA-IgG, the early antigen D IgG, and the EBNA-IgG. And here's a nice chart if you want to take a screenshot of this. This is Kasha Kynes is a friend of mine, Dr. Kasha Kynes, who wrote a good book on the Epstein-Barr virus solution. And she goes into how to diagnose Epstein-Barr correctly. But this is kind of a chart where when you have these different markers, you can take a look and you can use that to determine. The other thing too is that also with Cyrex's array 12, no, yes, I think that's the right one. The array 12, which is the multiple pathogen immunoglobulin test, they also look at a citrulline Epstein-Barr virus, which is quite sensitive, and that's a good marker as well. But with some, oh, there it is, this one. But with some of the other ones, like the cytomegalovirus and the HHV6, you're generally looking at the IgG and the IgM, which is more of the acute marker. The retroviruses, I don't know of many of the tests that are available for that. The treatments are, here, let me stop sharing here. Treatments are a little bit different. You do need different antivirals, and everything that we do is all natural. So I'm talking about herbs here, though you can use some pharmaceuticals, but pharmaceutical antivirals, they stop the replication, but they don't kill what's there. So you're not going to get more virus potentially, but you're still going to have that same amount of virus that you have present, right? So that's kind of where the herbal stuff comes into play. That can be really supportive, whether it's thuja or, oh gosh, what are some of the other ones that we like to use? St. John's wort, sage, lemon balm. Those are a number of the ones. Artemisia. Those are a number of the ones that we'll like to use for some of the herbs. Tacuna, cemento. So it depends on what we're working on, but those can be incredibly helpful. And the other things too, in terms of optimizing the immune system with some of the retrovirus stuff, is vitamin D, high dose zinc, quercetin in order to get the zinc into the cell, vitamin C. Those are a lot of them. And what's important to remember too is that the immune system has to be mostly functional in order to be able to get rid of these infections. Now, if you've got heavy metals, chemicals, or molds, or other infections, immune system's off in left field, bugs are having a party, and consequently, you can't get rid of them. So people, you can go at Epstein-Barr until the cows come home and trying to kill it, but if you've got heavy metals, chemicals, or molds present, you're not going to be successful because you got to get the immune system working with you and the herbs in order to be able to get rid of the virus. So hopefully that is helpful for you. Let's see, we got another question in the chat. What type of reaction do you get from Saccharomyces? So that was back on the last question, the Saccharomyces boulardii that somebody is using probably to push out yeast. So sometimes it can be gastrointestinal, where you may have more constipation or diarrhea. It can also be other yeast symptoms. So itchy ears, itchy anus are the biggest markers of having yeast or mold, and skin rash or itchy skin. So things to remember, things to live by. All right. Hopefully that is helpful for you, Karen or Karen. Let me just check and see what else you're working on. Nice. You're working on your step 4. You're working on removing the toxicities. You've gone through a lot of stuff. Excellent. Yeah. And that's the other thing too, is that it's never just one infection. Everybody who's got low energy and fatigue has 20 plus causes out of these 33 that we look at, and pretty much everybody has a combination of infections that are present. Okay, mold plus a couple of infections is usually the recipe, unfortunately. Nice job, Karen, or maybe it's Karen. All right, Roberta said, what causes reverse T3 to be at the top of the range while free T3 is lower than the midpoint of the range? Can this configuration cause symptoms of hypothyroid? Yes. So T3 increases your metabolic rate, and reverse T3 stops your metabolic rate. So when the body is in a stressful crisis, it wants to stop a bunch of things from happening in order to deal with that. So it produces a lot of reverse T3 to bind up the receptors so that those receptors, so that there's T3 that's not getting into the cells. So you're not increasing your metabolic rate. This is one way to, it's called, oh, I just blanked on it. It is the cell danger response, or contributes to the cell danger response, which is basically the body shutting itself down in order to be able to deal with the stress. So any sort of stressor can cause reverse T3 to be elevated. So I actually don't test reverse T3 anymore because it's elevated in pretty much everybody that I see, because that list of causes that we're looking at, deficiencies and toxicities, all those toxicities are going to cause elevated reverse T3. And consequently, then you're going to have low free T3. Now you can kick the reverse T3 off by increasing your free T3. And we do that with our subjective ramp up in the program. And I found that like 95% of people that we see who have low thyroid are not given enough thyroid. So we take you up to your top dose because everything works better when thyroid works better. You've probably heard me say this before, but thyroid is an amazing anti-inflammatory. It's amazing at lowering blood pressure. It is the best cholesterol lowering medication, much better than any sort of statin. It's good for so many things. Great for the immune system, great for your energy, great for your sleep. So hopefully that, and yes, it can cause symptoms of hypothyroid. If your reverse T3 is very high, it's going to block those receptor sites. Your T3 is not going to be able to get to those receptors, which means that you're not going to be able to transmit the messages from the reverse T3 that you need. Okay, and then I'm going to come back to the questions that are in the group. Let's go through the questions that have been pre-submitted. But we will get those questions that you guys are asking at the end. All right, so Deborah's question is what other causes besides blood clots might cause a D-dimer test to elevate? So D-dimer is pretty non-specific for inflammation. So you can have anything that causes inflammation. I'm not going to say anything that causes inflammation causes D-dimer, but there are a number of things besides a blood clot that may cause it. So I wouldn't necessarily worry about it. It sounds like you probably had concerns about a blood clot, and then you got a D-dimer and some other things. An ultrasound or a duplex is going to be a better test to determine whether or not you actually have a blood clot. But when you do have a D-dimer, it is telling you that there's something wrong and you do want it evaluated. So I shouldn't say don't worry about it. I should say if you're under the care of a practitioner or a doctor who's helping you with this, you should be doing all right. You definitely want it worked up. And then looks like you're taking all the supplements to step 3. Right. Oh, so you had to stop maca and anything with estrogen on the advice of your doctor due to concerns for increased chance of clotting. So that's interesting. So if you want to drop something in the chat around that, Deborah, about whether or not you had symptoms of clotting or whether you just had an elevated D-dimer, that would definitely be interesting to know. But yes, with some of these hormones, you may want to, there is some concern around it, but there's also some research. We do know that when you're taking estrogen, that it decreases your chance of having a heart attack or stroke. But there is some concern that can also increase clotting, which increases the risk of those. But most of the research is that it is supportive. But you also have to make sure that you're balancing any sort of estradiol with any sort of estriol, as well as with some progesterone. So, all right, hope that's helpful for you, Deborah. And then Sai's question, what do you suggest for patients with EBV? I also have mold, Lyme, low IgG, treating all but the EBV. Fatigue is present no matter how much you sleep, rest, or anything you do. Oh, sorry to hear that, Sid. So I talked about, a couple things. So one is going directly at the virus. And so that's with utilizing a number of these herbs that I mentioned before, like the St. John's wort and the lemon balm and the thuja and St. John's wort and sage and artemisia. Tacuna, there's a number of other ones, but those are some of the ones that I like. Oh, and then also lysine and vitamin C, those can be really helpful as well. Excuse me. But then, like I mentioned, in order to get rid of that Epstein-Barr virus, you gotta get rid of the mold, heavy metals, chemicals, and any other infections that are present as well. One of the things we're also finding is that you got to treat all this stuff together. There's something called the whack-a-mole effect that I talk about quite a bit. Like when you go to the fair and you're whacking those moles and they're kind of like popping up. When you go after one infection, other infections oftentimes pop out. And so having some coverage over those, it can be really helpful. So, and that's what we're seeing too, is that when you're going after something like Epstein-Barr virus, it's good to have a little bit of coverage over things like Borrelia, Bartonella, Babesia, Anaplasma, to make sure that if any of those things pop out, that you're not going to feel worse. And when I say coverage, I'm talking about like low dose herb tinctures to make sure that you've got the coverage there. And yeah, I guess that's about it. And then big picture, you want to make sure that you are removing all of the toxins that are present. Okay. Daphne's question is, what are the 3 most important things you can recommend to chronic fatigue sufferers like myself who deal with fibromyalgia and pernicious anemia, IBS problems, and food allergies almost constantly? Okay, well, like all of us, or, strategies are kind of what y'all are looking for right now, but it's important to remember big picture is making sure that you're finding the causes that you have. Okay, so there's 33 different causes of chronic fatigue. I showed you that on the chart that we looked at before, and that everybody's got 20 plus causes. Now, what's interesting is that oftentimes people who have an infection called Bartonella are misdiagnosed with something called fibromyalgia. So any infection that can get inside the muscles that can trigger inflammation and can cause the immune system to kind of come after it. Remember, we said immune system's job is just to get rid of things that aren't supposed to be in the body. Well, if that thing hides in a place where the immune system can't get to, like in the muscles, guess what? You get inflammation in the muscles because the immune system is trying to get at the infection. In terms of the pernicious anemia, this is autoimmunity to some of the receptors in the stomach, right? So what's that autoimmunity come from? It comes from these toxins, including infections like Bartonella. In terms of IBS problems, irritable bowel, this also comes from a number of toxins, including infections that are in the gut, and it can come from food allergies. So food allergies are basically caused by these toxicities. So when you look at food allergies, it's the immune system's response to food. You throw food into your mouth. Hopefully you don't throw it too hard, but you toss it into your mouth, you chew it up, hopefully 20 to 50 times, you swallow it, gets into your stomach, goes into the small intestine, into the large intestine, and gets visited, or it gets understood by the GALT, so the gut-associated lymphoid tissue. So basically the lymph system, the immunoglobulins, the immune system in the gut. And if the immune system sees this food as foreign, it's going to react to it. If the immune system is hyperactive because it has heavy metals, chemicals, molds, and infections that are present in the body that are causing the immune system to be dysfunctional, it's reacting to everything. Okay, and so that's why you're like, gosh, why am I so reactive to everything? It's because the image that I give people is that your body is like this barrel, this rain barrel, and through your life, you're accumulating toxins over time. So you come out of the placenta, you come out of the uterus, and we now know that there's around 300 different chemicals that are found in cord blood. And so consequently, we are born with a number of different toxins. And then if your story is like mine, I grew up with lots of tuna fish, and there's lots of mercury in tuna fish. I had mercury fillings. I ate a lot of gluten and dairy. And then consequently, I was chronically constipated. I would poop once a week for the first 20 some odd years of my life, which means that I would reabsorb all of the toxins that I was trying to get rid of out of my body, which would increase my toxic load. And then I lived in New Jersey and I got bit by a tick and I kissed somebody who had mono and got Epstein-Barr virus and lived in places that had mold. Pretty much I've had every single cause that we talk about. And so it's just very important to take a look at your life in that way and see all the toxicities that build up over time. And then eventually your body can't deal with it anymore. And you overflow this barrel, and then the immune system and the liver are congested and they react. Okay. So what I would say in terms of like the most important things, a lot of it depends on what you can tolerate. So I would imagine you may not be able to tolerate a lot if you're reacting to food allergies a lot or food a lot. And so working with something like a sauna, so things that you can do outside of your body that you're not necessarily swallowing. So sometimes coffee enemas can be helpful, food allergy, or not food allergy, saunas, foot baths. Oftentimes we're going to use topical tinctures. So tinctures that you can put in your mouth, you can also put on your skin. And so we rub those in, and that is really helpful for folks when they're more sensitive. So yeah, so you have to remember that even though you have a bunch of diagnoses, the root cause is generally the same. It's something that, I mean, with all these things that we've just mentioned with you, it's all about something that's triggering the immune system that's causing inflammation, right? And you just need to figure out what that is. Now, fortunately, 75%, I'll pull this up again, 75% of all the causes can be assessed by symptoms alone. So these are all the causes again. And if you see all the pluses, all these pluses, which makes up 75% of all these causes, can be determined by symptoms alone. Okay. And then the minuses need labs, and the equal sign is either or, symptoms or labs. Okay. So, so that's what you want to do. So generally when people join the program, they go through the workbook, and within an hour or two, they know 75% of their causes, which is incredibly powerful when you're shooting in the dark up till now, right? Okay. Hopefully that was helpful for you, Daphne. And then Bryce's question is, how can someone fix their liver function? My liver enzymes have been high on and off for years, even prior to me having chronic fatigue. So I'm going to guess it's one of my root issues. I have a hard time handling supplements if I take too many, but addressing lifestyle hasn't gotten me to 100%. So I guess I need supplements, but I have a hard time handling them. My liver doesn't seem to be very happy. Yeah, I would imagine. There's a number of things that can cause elevated liver enzymes. And they're all in that toxicity list, or not all of them, but a lot of them are. So it can be any sort of different infection. A lot of the infections will cause that. There are supplements that will actually do that as well. They'll cause elevated liver enzymes, but sometimes it's because the supplement is actually killing an infection that's in the liver. There are a number of things conventionally. You're going to want to make sure you see your conventional doctor to rule that out with the elevated liver enzymes. But for the most part, it's the toxins. The liver and the kidney, they're filters. And guess what happens if you try to put toxins through a filter? It clogs the filters, right? So once again, you got to remove this stuff. And so the process that we take people through, just to expand on that just a little bit, is the Energymd Method. So let me go ahead and share my screen. So it's this 4-step process to work on mental, emotional, and physical. So we know that if we leave no stone unturned, we're going to be successful, right? So we want to assess the causes by going through here, much like we've discussed so far today. And then what we do is we replace the deficiencies to make you as strong as possible. Then we open up the detoxification pathways that are clogged by the toxins, and then we remove the toxins. Okay. And what's interesting, so these deficiencies, we boost them first in step 2. However, these deficiencies are caused by these toxins. Like 80% of everything over here is caused by these toxicities, but we have to boost the deficiencies first to make you as strong as possible, adrenals, mitochondria, thyroid, etc., so that you can deal with removing the toxins later on, because that's where the ride gets more bumpy. And that's where you really need hand-holding in order to be more successful through this process. And for each of these things, it can take 6, 12, 24 months. And so you just want to make sure that whoever you're working with, that you've got good support, which is why in our programs, we now have our online community where you can get your questions answered guaranteed in 2 business days. This is like a Facebook group, but it's not in Facebook. It's on something called Mighty Networks. And then we also have the group calls so you can get your questions answered. And then we also have one-on-ones. So, and we do have a new monthly membership plus program. If anybody wants to hear about it, you can drop a comment in the group and I'll be happy to share that information with you, but only if you want. Okay, let me just double check and make sure there are no other questions that have been pre-submitted. And then we will jump into the questions that are in the group. And thank you for your question, Bryce. Hopefully that is helpful for you. Oh yeah, and so I'm just reading some more about you. So the liposomal glutathione and whatnot. So glutathione is amazing for the liver, but not everybody can tolerate it because it also mobilizes toxins and start moving things down. Yeah, so you've had a number of exposures, and so you really need to move through the process, figure out your causes, and etc. Okay, great. And yeah, I would imagine most of you guys are here because you've done a lot of the lifestyle stuff. So you've worked on your diet. You're probably mostly paleo. You are doing your best to sleep more, to get outside, get sunlight, eat better food, or I already said that. Get more movement potentially, though you do have to watch that because if you move too much, you're going to feel worse. Drink more water, right? You're doing all these things. And you're like, why am I not better? And then you go see a practitioner, naturopath, integrative doc, functional medicine doc, and they give you a bunch of supplements that basically replace the deficiencies that we've talked about: adrenals, thyroid, mitochondria, hormones, neurotransmitters, all of these things where it may help you out a little bit, but then you plateau. And then you're not sure what to do. And that's because so much of this is caused by those toxins. And then maybe you go see a Lyme specialist, but the Lyme specialist isn't necessarily dealing with mold. Or you see a mold specialist who isn't really dealing with Lyme. Or maybe you see somebody who's dealing with heavy metals, but doesn't deal with the other things, or doesn't deal with negative emotional patterns as well. You know, we have a trauma coach on staff to work with people in that regard as well. So anyway, you want to make sure you're addressing all these causes: mind, body, emotions, in order to be mind, body, emotions. Yes, in order to be most successful. Okay, so let's go to questions. So we talked about Saccharomyces. Okay, itchy anus related to parasites. Yes, that can definitely be related to parasites as well. That was from Brenda. And then Katie says, if I start working on the steps, can you lose weight? Absolutely. So generally, like I said, most of the people that we see who have low thyroid have not been adequately replaced with their thyroid. So we do ramp up to your ideal dose. And when your thyroid is ideal and you've removed gluten out of your diet and you're not consuming, if any, sugars and grains, and you don't have any other metabolic issues at play, usually people will lose about 3 pounds a month on average until they get down to their high school weight, as long as they were healthy in high school. Now, you do have to take that into context with adrenal function and mitochondrial function, because they contribute to thyroid function. And those, in order to talk about those, you got to take into context the toxins and the toxicities, right? So just keep all that in mind, but that is generally what we see. Then Brenda says, what is the best way to eliminate heavy metals, lead, mercury, arsenic, if I have difficulty with IV chelation? Yeah, so we don't do any IV chelation. Part of the reason why you have difficulty with IV chelation is because you haven't spent enough time in step 3. So we've talked a little bit about step 3, opening up the detoxification pathways, because if your liver and your kidney and your intestines and your lymph and your neural lymph, which is the lymph system in the brain, the garbage system in the brain, if they're all clogged, And I think of step 3 like this funnel. If the bottom is closed, guess what? You try to dump things in, like you're grabbing heavy metals and trying to get rid of them out of the body. Guess what? They just go right back into a different compartment or right back in this way, right? So you got to make sure step 3 has done its job and that pathway is wide so that you can start dumping a lot of these toxins in. So that's a big thing. And then the other things that we'll use, so we'll use different binders, non-prescription binders in order to be able to mobilize things. There's a number of different herbs that we use that can be really helpful. So it's mainly like herbal complexes that we're using, but you have to do more in step 3 first in order to be more successful. And I can't go into all of that here because we don't have all day, and that's another hour lecture. But that's what we do in the program. And then Kim asked, what do you recommend to boost low adrenal function? So my favorite product is Adrenal PX, which is a combination of rhodiola and some other herbs. So it's adaptogenic. And I find that to be really supportive. 2 capsules in the morning or at noon. You can get that from our store. And for those of you who haven't been in our store before, we now have a new supplement store, and we can drop the links there into the Facebook group. Ava, if you don't have those links, just let me know and I can give you that information. But you can with the information that we're going to put in the Facebook group, you can go ahead and you can register, and then you can access these supplements. One sec. Okay, so that was, actually, let me grab that just to make sure. Give me just a second. Okay. So that's how you would get the Adrenal PX. The other thing that I really like is Cortisol Manager. I call this the I don't give a SHIT pill because it is just really helpful for decreasing your central nervous system, your peripheral nervous system, your nervous system's response. So things that you would normally care about that you'd be really stressed about are less stressful. If you find that you're always on edge, this helps to take the edge off. So this is 1 capsule twice a day. And those 2 things are incredibly helpful. Plus also then mitochondrial function. I really like the mitochondrial recharge product that is in the store, 3 capsules in the morning, because mitochondria will help the utilization of adrenal function or the adrenal hormone, as well as allowing it to get inside the cells. So those are some of my favorite supplements. Hopefully that's helpful for you, Kim. And then Brenda asked, would you advise taking essential oils to prevent cancer and cirrhosis? That's, I would say, first off, that's out of my wheelhouse. I do not specialize in cancer. Second off, I think that there's a lot of other things that I would do first before doing essential oils for preventing cancer. But if you did want to use some essential oils to improve detoxification, I'm also not an expert in essential oils, but if you did want to use some to improve detoxification as well as go after some infections, that could potentially help, but I would say no, would be my answer. And then Deborah said, no symptoms. Okay, so you weren't having any symptoms, it was just that your D-dimer was elevated. So if that's the case, I wouldn't stop your hormones, but that is me. I would just, if I was concerned about it, I would actually give you some natural anticoagulants like nattokinase or lumbrokinase or whatever that will significantly reduce your ability to clot. Doesn't mean if you bleed, you're not going to have a clot like you normally should. But it's really nice for if you do have a clot, the clot is digested. Okay, I've used this with a lot of people, especially with cardiovascular issues, but I would look at some of the other potential reasons. I mean, a number of these toxins that we talk about could be causing that D-dimer. So, because if you look at, what are the causes of an elevated D-dimer, you're going to get a lot of, this is non-specific, it can be an inflammatory marker. Okay. And then Brenda asked, what is your approach to treating mold, parasites, arsenic, mercury, lead, yeast, and bacteria? That's a whole lecture in its own, Brenda. But what I can tell you is that the 4-step process is part of my approach, but I do like to address all those things at the same time for the most part, because most of the time they're all kind of contained in what I call this toxic matrix, where you have a lot of these toxins that are feeding off of each other. So the parasites are housing a number of these toxins, heavy metals, chemicals, molds, and infections all can live inside the parasites. And then and then a lot of these things, these infections are feeding off of heavy metals and chemicals. And so there's a number of different things that we'll use for each of those, but none of it is pharmaceutical. All of it's herbal. All of it is physician brand supplements. But you've got to make sure that things are open. We'll use binders like activated charcoal or humic and fulvic acid. We'll use things like glutathione. So I'm not giving you like, hey, this is the supplement that you need to do for all of these, because you have to take it into context. And if I gave you all the supplements that we normally use for those things, you're just going to feel worse because you haven't gone through the process. I'm going to keep saying this until I'm blue in the face. Step 3 is so important. And so you have to open up those pathways. Otherwise, you're going to feel worse pulling out these toxins, right? And you're not just going to get if I give you all of those as well, you're not going to get the results that you want, because this process is a bumpy process and you need hand holding. You need somebody to be there to answer your questions along the way. Okay. And then Bryce said, I've been to your family doc many times. He doesn't seem concerned about your liver. Okay, gotcha. Yeah, so then I would just look at these toxicities and working on them. And then Kim said, that's helpful, thank you. Can you take the Adrenal PX and the other supplements with thyroid meds? Any interaction? Yes and yes. So you can take them with thyroid meds, but what's important, so when we go through our program and when we take people through our program, we always start off with supporting the adrenals first, because adrenals will make the thyroid better. And then we support the mitochondria, because mitochondria will make the adrenals better and the thyroid better. And so consequently, when we then give somebody thyroid support, and we're using glandulars and other things in order to improve thyroid function, because I don't prescribe in the online space, I'm just a health coach. I shouldn't say just a health coach. I operate as a health coach in the online space, not as an MD. And so everything that we do is natural. And I make education, I provide education and make recommendations, much like I'm doing here. And so we're optimizing thyroid along the way. So then the exogenous thyroid, or like a thyroid medication that you would need, is much less. So consequently, if you take the adrenal support that I recommend and the mitochondrial support that I recommend, you could end up being hyperthyroid, because they will make your thyroid better. And then all of a sudden, you're not going to be able to sleep. You're having diarrhea. You've got your heart jumping out of your chest. You've got tremors like you just drank a pot of coffee, and you've got anxiety and agitation. Right? So that means that you've got too much thyroid flowing in your body, and you need to decrease the amount of thyroid medication that you're on. So it's not ideal to kind of do it in reverse, where you're on thyroid medication and then you take adrenal and mitochondrial support, and then you need to decrease your amount of thyroid medication, but it can be done. But once again, you have to remember that these are all, what I'm doing right now is I'm educating and I'm making recommendations, but we do not have a patient-physician relationship. I do recommend that you do go speak with your provider. This is not medical advice. Okay, so I don't want you guys hurting yourself. So you do need to have somebody hold your hand through this process. If you join one of our programs, I'm happy to do it, but otherwise just do it with your local provider. Okay, I don't want you guys to get hurt. Okay, and the next one was Elizabeth. I still agree with step 3. I ended up with full-on mercury poisoning for around 3 months because a homeopath gave me something to mobilize mercury without checking my detox pathways were open. It was horrible. Oh, I'm so sorry that you had to deal with that, Elizabeth. But yeah, it is one of the main reasons why people feel worse in their protocols is because they have not spent enough time in step 3 opening the detox pathways. And then what ends up happening is that you're looking for the ideal rate, which I was working on my daughter's math the other day, and she was learning about rate, right? So it's like the amount that you're dumping in versus the amount that you're able to get rid of, right? So if you've got these detoxification pathways, oftentimes I describe them like tubes, and you grab some mercury or some arsenic and you dump it into these tubes. If these tubes are open, how open are they? You want to make sure that the amount that you're dumping in is equal to the amount that you can get rid of, because then you're not going to feel worse. If you do feel worse, then you go back to step 3 and you take some additional supplements to open up these pathways in order to be able to continue this process. But the body likes slow and steady. The body likes small changes. So it's better to get rid of your toxins over 12 months or 24 months than it is over 3 months, because you may be able to mobilize them and dump them, but consequently, it's just really hard to get rid of everything that your body needs to get rid of in an expeditious time frame. Okay, this is a marathon. It's not a sprint. Anybody who's promising you that that this is going to be done in a short amount of time, you're either not that sick or you don't have all of these different causes, because it just takes a while. Just want to be forthright with you guys. So Brenda says, or she's, oh, we got somebody else. So Bryce said, do you look at people's labs in the program too? I'm wondering what would be the best course of action for me to take to get on this ASAP, your course or an appointment or both. Gotcha. Yeah, Bryce, I apologize. I remember seeing that you had a question and I have not answered it yet. So let me make a note, because I will also do that in the group. But yes, so in our anything in our group components, we go over labs. So, and we go over them on the group Q&As. And so twice a month, we've got those Q&As, and we can go over them. If you have one-on-ones with me or with Mickey, then we can go over them as well, whatever Mickey feels comfortable with. She doesn't feel comfortable with all of the labs, as far as I know, but a lot of them she does. She's very smart. And so those are the places where you could do it. So if you jump into the course, you're not going to be able to get that taken care of. But if you do jump into our new monthly membership plus program, which I can share if you guys are interested, you will be able to. And we go over 1, maybe 2 labs per person to make sure that everybody gets their questions answered, like per session. So so hopefully that helps. Okay, you are welcome, Bryce. And then Brenda said, I use humic and fulvic acid, oxygen, mistletoe, dandelion, glutathione, mimosa pudica, NAC, quercetin, vitamins, bioactive carbon, carboxy, mega IgG 2000, megaspore, Saccharomyces, as well as homeopathic kidney support and advanced TUDCA. Nice. Yeah, that sounds really good. So you just have to, you just need to figure out what is the correct rate where you can be pulling things versus keeping those pathways open. But yeah, that's a lot of good stuff that you're mentioning right there. And then Brenda says slow and steady. What's the monthly cost? Okay, great. Yes, so it is just about 5 o'clock. So yeah, so let's talk. Are you Brenda? Are you asking about the monthly membership? Is that what you're asking about? I think that's what you're asking. Okay, well, I will go ahead and share my screen and share this with you guys. I'm really excited about it. I'm curious about the monthly membership too. Okay, great. Yeah, so let me share this with you guys. So I've been thinking about how to support you guys at a price point that is more affordable. And that also doesn't require a lot of risk. So what we do see on our programs is that getting your questions answered on a daily basis, as well as face-to-face with me, is essential. Okay. And then having monthly one-on-ones with Mickey, people who have one-on-ones with Mickey do better in our program. It's just kind of how it goes. And so this way, you're going to get access to me, you're going to get access to Mickey, you're going to get access to our nervous system retraining coaches, Martha and Stacy. And then also you're going to get access to the complete workbook and all of the videos and course material. And this is a month, and it's for $497 per month. So this is a month-to-month program. So if you jump in and you figure it's not for you, or you go for 3 or 6 months and you're all better, or whatever it is that you need, you can jump out of the program. So it's kind of like what you need when you need us. And then, so you've got for every month that you're in the program, you get the monthly one-on-one coaching calls with Mickey. And then you get twice a month group calls with me where it's face-to-face. So it's like you and me in a Zoom room, except there's 10 to 15 other people in the room who are learning from you and you're learning from them. And it's a really amazing community of people. Smart, caring, this is a very heart-centered community. And so when we talk about working on mind, body, and emotions and spirit, is that we're looking at all of these different components. And so we're working on mindset. And so if you don't want to work on mindset, don't join this program, okay? Because it's a big part of what we do, and it's such an important part. Obviously, the physical stuff are things that we're doing, and then the emotional stuff. So we have nervous system retraining with these amazing coaches as well. So there's the group calls with me, and then there's a private online community. So this is like a Facebook group, but it's in something called Mighty Networks, that where we guarantee you're going to get your questions answered in 2 business days, and you basically post, and then me or a member of my team is going to answer the question. I look at every single question to make sure that the answers are correct. And then here's the nervous system retraining. So these are trauma coaches. They're actually trained in something called NARM, which is Neuroaffective Relational Model for Trauma. And it's a mindfulness-based technique. And it's like resetting your nervous system, resetting your limbic system retraining. It is not like DNRS or the Gupta program, but it does something similar. But that is also a nice complement to the work that we're doing here, if you wanted to do those other programs. And then we also have the community check-in calls with Coach Stacy, who's trained as that trauma coach, and I should say trauma-informed coach. And the thing that's important to note about trauma is that we all have trauma. Okay, anything less than nurturing is now considered traumatic or an ACE, an adverse childhood event or an adverse life event, right? So this is, if you are a student of life and you want to get better, it's about improving every aspect of your mindset and consequently your mental health, your physical health, and your emotional health. And so you're going to be learning along the way. Even if you've done years and years of talk therapy or whatever, this is just about improving who we are as humans and growing, right? And then every single week, Stacy does her group meditation sessions, and she just hit 100 in a row a couple weeks ago. So that's kind of cool. And then there's the workbook and the in-depth course material. And if you guys want more of a tour of the workbook, I'm happy to do that. Just type that in the chat. Okay, so I will go ahead. Let me stop sharing for a second so I can grab the link, and I can drop the link to the program into the Facebook group. But I want to hear from you guys. What do you think of that new program? Do you feel like that would be helpful for you? Where would you put that on like a scale from 1 to 10? 10 being, yes, this is exactly what I'm looking for, or 0, this is not what I'm looking for at all. Where would you guys put it? I'm just pausing while I grab this link. And I don't have to put the link in there if you guys don't want the link. I don't want to. I only want to do it if you guys are interested in it. All right, let me go ahead and drop this link in here. I hear you, Bryce. Well, and one of the things too that's really important to remember is that most of the time when people start going through the program, the workbook is, I get lots of compliments on the workbook. I'm not going to say the workbook's so good, I'm going to toot my own horn, but if we have any people who've gone through the program who are here who can attest to how good the workbook is, or if you watch a lot of the success stories that we've had, if you go to fixyourfatigue.com/results, or you click on results from our webpage, a lot of people talk about how good the workbook is. Somebody, if you look at Justin's testimonial, he's like, you were okay, but the workbook was great, or sort of thing. Wherein he found Mickey plus the workbook was essential to his success, and we've seen that kind of time and time again. And I'll just share my screen right quick so you guys can see a little bit more about the workbook. So with the workbook, there is a master checklist and important links. And you basically walk through this process. And so it basically tells you exactly what to do. And then you go through the workbook and you do it. So you budget 30 to 60 minutes a day. You work through the workbook, you watch the videos if you want to, you don't have to watch the videos. You put your questions in the group, you ask your questions in the online community, you ask your questions on the group with me, you have your one-on-one with Mickey to make sure that you're on track. Like, our goal is for this to be foolproof, essentially. So if we take a look kind of at the master checklist, there are some logistics, join this, do this. And the other thing too is if you have brain fog and you're not sure where you left off, guess what? You have made a copy of this, you've put this into your Google Drive, and you can check these off as you go. Or you can print this out. It's like 100 pages, so you probably only want to do that once. But you can go through and you can check these off so you know where you are in the process, right? So then there's mindset, create your daily mindset practice. Step 1, finding the causes, right? You start going through step 1, which are checklists, to determine which causes you have. And any questions that you have, you ask, and we help you. Step 2 is then, which supplements do you take, right? And so we help you through that process. And then we also have a supplement introduction guide, which basically, based off the cause that you have, then you're going to go ahead and you're going to introduce a number of these products. And then we have supplement store. This is our new supplement store. And then we also have stores in the UK and the European Union and New Zealand. And then we tell you, like, this is how we recommend that you organize your pills. And this is how we recommend that you keep track of your symptoms and your supplements, right? And here's some notes on supplements and things that you can expect. And then here's some of the labs that we recommend that you get, the 25% that aren't covered by your symptoms. Right. And then as the labs come back, you can actually just watch the videos in the course and figure that out, or you can ask me, or you can ask Mickey as you're going through the process. Right. And then step 3 supplements, step 4 supplements. You get, when you join the program, you get 5% off all of your supplements. And then here's where the bumpy stuff comes, the infection protocols. And this is really where you want us in order to be able to help you through the process. And then you graduate. And then how do you wean off of your supplements, right? So that is that. Hopefully that is helpful for you guys. Okay, great. Yes, and then so, excellent. Thank you, Elizabeth. I appreciate that. Would have helped me more a year ago, already doing most of the things you mentioned. Thanks for your input, is very much appreciated. Have another program to attend. Sounds good, Brenda. Welcome. Glad you were here. And then Bryce said, so I could book an appointment with Mickey or you, correct? Yes, when I bought your book years ago, at the beginning, you had a list of labs for someone to get. Is that list still the same? It's pretty darn similar, except now I know a lot more, and the list is smaller. So you don't have to do as many labs as we used to say back in the day. So that's where the 75%, the 25% come from. 75% of those causes can be determined by symptoms alone. 25% need the labs. And so those are the labs that I would recommend that you would get. But yeah, I would say, you don't know what you're going to need in the program, and you can always add on other things like calls with me and whatnot. So, all right, so let's go ahead and conclude. So great seeing all of you guys. Or not seeing you. So great hanging out with you. Hopefully this was helpful for you. Oh, and then Bryce has another question. Okay, where could I find that list? You're going to get some new labs. Great. Yeah, well, you could do that, or you could jump in the program and get the labs, so that the new list is in the program, and you can get that when I share with you guys the step 1 course, which is takes you through figuring out all of your causes. Yes, but you can also get that list by going through the step 1 course if you want to do that first. So yeah, so thank you so much for joining us here today. Hopefully this was valuable for you guys. We're doing this every month. If this is valuable for you, please give this video a thumbs up and drop a comment below and let us know, so that we know that we are serving you in this way. All right, many blessings. Stay in gratitude. Keep staying positive. Keep up with your affirmations and your positive mindset. And we'll see you next time. All right, be well.